Knock knock. Hello. How are you doing today? My name is Shakira. I'm going to be your nurse today, and I'm going to be performing a head-to-toe assessment. But let me provide some privacy for us while I finish up my hand hygiene. Okay. Can I check your arm bracelet? Can you give me your name and your date of birth?
Encourage Dasher 2005.
Can you tell me around what time it is?
Afternoon.
Can you tell me today's date?
Wednesday.
Okay. Can you tell me why you're here?
At the zoo.
Okay. So now what I'm gonna do is call the Fallon's test, and what I'm gonna need you to do is take your hands and put them back to back like this right here, and it's gonna be checking for carpal tunnel. So can you do that for me? And while you're doing that, for 1 full minute, I'm gonna read off your vital signs that were taken earlier today. Okay? Okay. So your temperature was 97.8 degrees orally. Your respirations were 16, normal depth. Your blood pressure was 120/80, taken in the left arm. Your oxygen level was 99% room air. Your pulse was 68, radial pulse, 2 plus force, regular rhythm. Your vision was 20/20. Do you have any pain today? Okay, just a few more seconds. Okay. What about any cough, shortness of breath?
No.
Any respiratory problems?
No.
You have any history of TB,
No.
pneumonia?
No.
You have any chest pains?
No.
Okay. Okay, you can stop. You had your TB shot today? Recently? No? Okay, thank you. Now I'm gonna check your hands for, are you having any tingling
No.
or tenderness or pain in your hands?
No.
Okay. Now I'm gonna check in for crepitus. No crepitus. Now I'm checking for clubbing. No clubbing. Capillary refills less than 2 seconds on the right. I'm checking for crepitus on the left. No crepitus. No clubbing. Capillary refill less than 2 seconds on the left. Okay. Okay. Skin is warm and dry to touch. Skin is tan. Eyebrows symmetrical. Head is normal cephalic. No infestation. Nicely groomed. No lesions. No edema. No swelling. So now the temporal artery. 2 plus force. Now the T and J. Could you open and close for me? Move from side to side. Okay, now I'm gonna check your muscle mastication. Could you bite down? Okay, muscle mastication, 5 out of 5. So now I'm gonna go to your lymph nodes. Preocular, postocular, occipital, jugular digastric, jugular digastric, submandibular, submantle. Turn your head for me, please. Anterior, posterior, deep cervical, anterior, posterior, deep cervical. Shrug your shoulders for me. Do like this. Super clavicular. No lymph nodes palpable. Okay, now I'm gonna do my cranial nerves. Start with cranial nerve number 1. Nose is midline, no drainage. Need you to hold on one second. Mucosa is pink. Okay, can I get you to occlude one side of your nose and breathe in for me? The other side. No obstruction. Okay, now I'm gonna get you to do the same thing, but this time I'm gonna have you to close your eyes and you tell me what you smell. Okay. Okay, close your eyes. Occlude one side of your nose. What do you smell?
Nail polish remover.
The other side.
Alcohol.
Okay. Cranial nerve number 1 is intact. Now cranial nerve number 2, which is the Jaeger card. I'm gonna get you to hold this out 14 inches away from your eyes, and you read the smallest line.
Ice breakers, ice cubes.
Okay. Patient was able to read the first line. Very good. Okay, now cranial nerve number 2 is intact. Now on to cranial nerves 3, 4, and 6. Look up for me. Look down. Okay, sclera is nice and white. Conjunctiva is pink. Little visible pinkish reddish veins. Okay, now I'm gonna pin light. First I'm gonna measure your pupils. Okay, pupils are a 4 on the left, a 4 on the right. Now I'm going to check to see if your pupils constrict to light. Other side. Okay. Pupils constrict from a 4 to a 3 on the left and a 4 to a 3 on the right. Okay, now I'm gonna check your extraocular movement. I'm gonna have you to follow my finger. Okay? No nystagmus is present. Okay, so now cranial nerves 3, 4, and 6 are intact. Now going on to cranial nerve number 5. So I'm going to check the sensation in your face. Can I have you to close your eyes for me and you let me know when you feel anything?
Feel.
Okay, cranial nerve number 5 is intact. Now going on to cranial nerve number 7. Can you smile for me? Frown. Raise your eyebrows. Blow your cheeks. Okay, cranial nerve number 7 is intact. Going on to cranial nerve number 8. Okay, your ears are symmetrical, no redness. Okay. So, if I had my optoscope, I would be pulling his ear up and back, and I would be looking into the ear and seeing that the tympanic membrane is pearly gray and maybe a little cerumen, and that the conal light is at 5 o'clock on the right. Moving to the left, I would be pulling his ear up and back and looking into the ear, and his tympanic membrane will be pearly gray, maybe see a little cerumen, and that the conal light would be at 7 o'clock. Okay, now I'm going to do something called a whisper test. I'm going to have you to wiggle your tragus just like this. And you tell me what I'm saying. Keep doing it while I'm whispering.
1, 2, 3.
Okay, do the other side.
ABC.
Okay, cranial nerve number 8 is intact. Now moving on to cranial nerve 9, 10, and 12. Okay, now starting with cranial nerves 9, 10, and 12. Lips are moist, no cracking. Can I get you to open your mouth for me, please? Okay, buccal mucosa is nice and pink. All teeth are present. Can you stick your tongue out for me? Move it from side to side. Okay, no tremors, no deviation. Can you lick your stick your tongue out and say ah? Ah. Okay, uvula is present and tonsils are 2+. Okay, now I'm gonna check your gag reflex. Can you open for me? Gag reflex is present. Cranial nerve 9, 10, and 12 are intact. Now moving on to cranial nerve number 11. Can I get you to shrug your shoulders for me? Move your head from side to side. Shrug your shoulders for me. Okay. Move your head towards my hand. Okay. Move your head towards my hand. Okay. Cranial nerves number 11 intact. And okay, now I'm gonna check your skin turgor. Skin turgor, no tinting. Now your carotid artery. Okay, carotid artery is a 2+ force. Now I'm gonna listen to your carotid arteries with the bell side of my stethoscope. And what I'm gonna get you to do is breathe in and breathe out and hold it, okay? Breathe in, breathe out, and hold. Breathe in, breathe out, and hold. No breeze heard. Okay. Patient is sitting straight up in a relaxed position. No distress. Now I'm gonna palpate. Okay, no crack is felt. Can I get you to say 99?
99. 99. 99.
Breathe in and out. Chest expansion symmetrical. So now I'm gonna oxytate. Okay. Have you to breathe in for me and breathe out. Breathe in, breathe out. Breathe in, breathe out. Again. 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 Okay. Lung sounds clear. Okay, now I'm going to check your trachea. Trachea is midline. Now I'm going to check your thyroid. Could I get you to swallow for me, please? Okay. Again. Okay. Thyroid is not palpable. Okay, now looking at your skin is warm and dry to touch. No lesions. So now I'm gonna palpate for crepitus. No crepitus felt. Say 99 for me.
99.
Again.
99.
Again.
99.
Again.
99.
Breathe in and breathe out. Chest expansion symmetrical. Now I'm gonna percuss. Dull sounds heard. Now I'm gonna auscultate. I'm gonna have you to breathe in and breathe out for me, please. Again. 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 Long sounds clear. Now I'm gonna do CVA. Any pain or tenderness when I did that?
No.
Okay. Okay, now I'm gonna let your bed up to between 30 and 45 degree angle. I'm gonna take your pillow from you. Could you lift your head up for me? Okay, like that. I'm gonna check your JVD. I'm gonna find your angle of Louis. And I'm gonna take my ruler and I'm gonna measure. Could you turn your head to the left for me, please? And JVD is less than 2 centimeters. So now I'm gonna give you back your pillow and I'm gonna let the head back. I'm in the bed back down, flat. And now I'm gonna start with your cardio and I'm gonna inspect, and there are no lifts or heaves. So now I am going to palpate the heart. No thrills. So now I'm going to percuss from the axillary line to the sternum border. Can I get you to hold your arm for me, please? Okay. Dull sounds heard over the heart. Now I'm going to auscultate. Second intercostal space on the right, aorta. Second intercostal space on the left, pulmonic. Third intercostal space on the left, Erb's point. Fourth intercostal space on the left, tricuspid. Fifth intercostal space on the left is the mitral valve at the midclavicular line. Okay, I'm gonna find your apex. Okay. Now I'm gonna flip my bell tone around and I'm gonna listen for 1 full minute. Okay, S1, S2 heard, no murmurs. Okay, your apical pulse was 64. Now we're moving down to the abdomen. Your abdomen is nice and flat and symmetrical. Your umbilicus is symmetrical. Now I'm going to auscultate. Lower right quadrant, upper right quadrant, upper left quadrant, lower left quadrant. Vowel sounds heard. Now I'm going to auscultate with the bell side. The aortic, right renal, left renal, right iliac, left iliac, and we would do the femoral, but we're not going to do that today. So now I am going to percuss your abdomen. Okay, now I'm going to lightly palpate your abdomen. Okay, now I'm going to deep palpate your abdomen. Lower left quadrant, lower right quadrant is the cecum. Upper right quadrant is your liver. I'm going to get you to place your arm up here for me. I'm going to get you to breathe in and breathe out. Take a deep breath in and breathe out. Okay. Liver is not palpable. Okay. Upper left quadrant is the spleen. Lower left quadrant is the sigmoid colon and the descending colon. Okay, your legs, the hair is evenly distributed and the skin tone is nice and tan like the rest of his body. Okay, now moving down to the feet. Looking in between his toes, there are no lesions. Okay, don't let me push you down. Don't let me push you up. Okay, inversion. Bring your feet in, inversion. Eversion. Okay, rotate your ankles for me. Rotate. Move your on both feet for me, please. Okay. Now, abduct, spread your toes. Adduct, bring them back in. Okay. Okay, plantar flexion, point them down. And dorsiflexion, bring them up. Now I'm gonna check your pedal pulse. Dorsipedal pulse is a 1+, bilaterally. Tibular, posterior tibular pulse is a 1+. And capillary refill is 2 seconds, less than 2 seconds. Okay, now I'm gonna let you sit in a tripod position. So if I had my reflex hammer, I would be checking for your patella and Achilles reflexes, and hopefully they will be a 2+. So now I'm gonna do your knee resistance. Don't let me pull you out. Okay, don't let me push you in. Okay, knee strength is 5 out of 5. And also, if I had my tuning fork, I would hit it on the side of something, and I would place it on the side of each of his inside of his big toes, and he will say that yes, he feels vibrations. Okay, now we're going to start with some range of motion, starting with your hands. We're going to flex, extend, hyperextend. Gonna abduct, adduct. We're going to radial deviation, ulnar deviation. Now we're going to your wrist. No, you're going to squeeze my fingers as hard as you can. Okay, patient's hand strength is 5 out of 5. Now we're going to your wrist. And we're going to flex, extend, hyperextend. We're going to rotate. Now we're going to your elbow. Then we're going to flex, extend, hyperextend. We're going back to your elbow, and I'm going to check your elbow strength. Don't let me pull you. Don't let me push you. Okay, elbow strength 5 out of 5. Now we're going to your shoulders. We're going to flex, extend, hyperextend. We're going to abduct, adduct. We're going to circumduction. We're going to external rotation, internal rotation. Now I'm going to test your shoulder strength. Shrug your shoulders for me. Okay. Patient shoulder strength 5 out of 5. Now we're going to go to your hips. We're going to flex, extend, hyperextend. The other leg, flex, extend, hyperextend. We're going to abduct, adduct, abduct, adduct, circumduction. We're going to internal rotation, external rotation, internal rotation, external rotation. Now I'm going to check your strength. Abduct, abduct, Adduct, adduct. Okay. Abduct. Okay. Adduct. Okay. Patient's muscle strength 5 out of 5 for the hips. Now I've already done the ankles and the toes, so now I'm going to do the spine. I'm going to get you to flex down and touch your toes. There's no curvature, no signs of scoliosis in the spine. So I'm going to get you to extend up. Now I'm going to get you to hyperextend. Lateral rotate, lateral rotate, rotate to the right, rotate to the left. Okay, now we're going to test your gait. I'm going to have you to walk all the way down. Turn around and come back on your tippy toes. Now halfway on your heels. And now I'm going to get you to do heel to toe, just like this. All the way down for me. Okay, patient walks at a steady gait. Now I'm going to do your bicep. And if I had my reflex hammer, I would hit my thumb and your pulse would be a 2+. Now your tricep, I will hold your arm like this, and if I had my reflex hammer, I would hit my thumb and your reflex would be 2+. And on this arm, same thing. If I had my reflex hammer, I would hit my thumb and your reflex would be 2+. And for the tricep, I will hold like this and I will hit my thumb if I had my reflex hammer, and you'll be a 2+ on that side also. Now we have concluded our head to toe assessment, and thank you so much for participating, and you may have a blessed day.